I think we're past the technical difficulties.
Right. Sounds good.
Awesome. So thank you for being my first Zoom call, not tele, I was about to say telehealth. Thank you for being my first YouTube.
I'll be your first telehealth.
I mean, you're in training, aren't you? So
I have back pain.
you have back pain?
I'm kidding.
There's too much, like an eval there. An entire
Simulating a case for you.
Andrew is a second year medical student at Meridian Health, or it's not Seton Hall Med School now. It's, what is it officially called now?
Hackensack Meridian School of Medicine. It used to be called Hackensack Meridian School of Medicine at Seton Hall. Now they just dropped the Seton Hall.
So you're a second year med school student. We both met each other at Seton Hall freshman year. Yeah. And then you transferred to Notre Dame because you were too smart for Seton Hall.
That's not the reason.
You can't say, no, you're too humble. You're too humble. It's okay. But yeah, so Andrew is a really good friend of mine. We've been in touch since freshman year, pretty much, of undergrad. That's when I met him. And he was a good study partner, pretty much the guy to go to when you needed help for biology or chemistry. So that's how I met him. He also ran track and field at Metuchen, I believe. Is that right?
St. Joe's.
St. Joe's, that's a private school you attended.
In Metuchen.
In Metuchen, my bad. And Andrew, just kind of walk me between you being at Notre Dame your sophomore year to you being now a second year at Hackensack Meridian Health Medical School in New Jersey.
Sure. Let's see where to start. So yeah, so freshman year I was at Seton Hall, with you. Had a great time. But we always really wanted to go to Notre Dame, and it's a bigger school. Like, of course, the football team, and also my brother went there, and he was actually in school at the same time that I transferred there. Notre Dame, I majored in psychology and bio. Before going to med school, I got my master's in bioethics at Case Western. Mm-hmm. And in 2019, I enrolled in medical school.
So you said bioethics, 1 year master's, is that right?
Yeah, 2018 to 2019. Med school started in July 2019.
I forgot. I remember you scrapped 1 year of applications. You've only applied once to med school, or you applied twice?
I applied once, but I was in the process, like you said, of applying.
And then you scrapped.
Yeah, after summer of junior year, I was planning to apply, but then I scrapped that application.
Okay, so when you were at Notre Dame, you scrapped the application because tell me what happened there.
Well, like most medical students know, like just applying like after junior year is a lot. That's why like 50% of my graduating class did not go right into med school. They went gap years and other stuff. Yeah. It's just a lot to do. So like junior year, like the MCAT requires you to take like all your courses, like biochem and physics, and then you finish that around the end of junior year. Mm-hmm. Then you take the MCAT, and on top of that, you got to start applying that summer. So it just was.
Sounds like there's a lot on your plate.
And also, I didn't like my score. So
the MCAT score.
Yeah, and like a big part of applying, especially at Notre Dame, they did a really good job. Was the end of your junior year, they met with you, and they said they gave you like a red or a green light. They looked at your application where you wanted to apply, and essentially I got like a yellow light, and then I got my MCAT and moved back to a red light. So decided to take another year.
Oh, okay. So you were in a yellow light grade wise, and then the MCAT score kind of brought you to a red light at Notre Dame.
And also I needed a little bit more clinical experience.
Okay. So for a lot of med school students, it seems like a master's kind of bumps you up in terms of your chances of getting accepted.
I wouldn't say like there's one route to medical school, but I think the master's helped me because I got a lot of clinical experience in that year, like actually going to the hospital and like shadowing and really having a passion for medicine, and that's what medical schools want to see.
Okay. Do you mind sharing your MCAT score, like your first time around, then your second time around, where you felt more comfortable? Or it's up to you. I'm not gonna make you.
Sure. First time around, I believe it was a 504. Second time around, it was a 505.
Mm-hmm.
And like if you super score everything, like so you take the best score out of each category. There's 4 categories.
Okay.
It adds up to like a 510.
All right. So you got a 510 super score. You were happy with that. You got your master's, and then you applied to how many schools?
I applied to about 13. I completed 13 applications. I applied to 15. I just didn't feel like.
Damn, that's a lot. But I mean, you got to increase your chances, right?
That's typical. Most people apply anywhere from 15 to 20,
Mm-hmm.
30. It all depends how much money.
That's expensive, right? Isn't that like $100 each school, pretty much?
It's more than that.
Yeah.
Some schools, yeah, it's expensive. Med school,
Okay.
even before going to med school, it's very expensive.
Is there anything else you want to add, like besides like how did that go? Like your bioethics experience?
Yeah. So funny story about that. It was going to senior year. I think it was like maybe like winter. Once you sign up for like the AMA, American Medical Association, like they sent you a bunch of stuff about gap year programs and stuff,
Yeah.
and that came into my inbox like one random day in the winter.
Mm-hmm.
And what really got me was that program makes you do 160 hours of clinical like rotations. So you're in the hospital doing rounds, like observing, getting to shadow. And I think that really helped me get into medical school.
Rounds, is that just doctors or is that also like nurses? Like who's in the room during rounds?
Rounds is not actually in a room, it's in the hallway outside, like the floors.
Okay.
It's the attending, your residents, your medical students, your nurses, your pharmacists.
Is the patient there sometimes, or is the patient usually in the conversation?
Sometimes, but it's usually the patient may be like too sick.
Mm-hmm.
Usually what happens is you round outside the patient's room.
Mm-hmm.
Like you discuss the case, and then after you discuss it with the attending doctor, you go in and see the patient.
That sounds pretty cool. So yeah, I'm sure that definitely helped you, and that gave you a whole breadth of experience to pretty much say you're ready for med school. You are now a second year. What was your first year like?
First year was, so our curriculum, like our school is unique in that we graduate typically in 3 years with a 4th year option to do whatever, like research or opportunities to get another master's degree. So the first year and a half is your core sciences and your basic sciences. So all your book learning, all your preclinicals, and I just finished that a couple of weeks ago.
Okay.
The thing about 3 years is that it's very accelerated. We started very early in July, and we had very little breaks.
July. You started July for a year and a half. How many weeks of break or days of break would you say you had in between?
I think in total we had like 5 weeks.
Okay. So and this is like maybe like a week or two for like winter break.
Winter break was about 2 weeks or a week and a half.
In the summer.
Summer we had 2 weeks. Spring break was about a week and a half, and then.
Tell me about like your professors. Do you feel like there was a consistent schedule, or did you feel like there was just lots of different guest lecturers speaking to you? And I remember we've talked about this a little bit, and the impression you gave me is that there's no consistent professor that stays with you long term. Is that right?
Yeah. So there's a consistent professor who teaches the block, who's in charge of running the block. Like they're in charge of the questions on the exam, and they're in charge of bringing in guest doctors and stuff. So I would say like the first 2 blocks was pretty consistent. The core faculty primarily taught like the basic sciences. Once we got into the more clinical and like more disease oriented topics, we got a lot of guest lecturers, and that varied week to week, day to day.
So this is when things were still in person, right? Because you started July 2019. So you had like a year. No, not even. You had like about 8 months where you were in person, right?
Yes.
So while you were in person, did you have like, you said you did like clinical like kind of prep too, or no?
What do you mean by that?
Like where you were like kind of recorded and you were given feedback about patient interactions.
Oh yeah. So our school is unique in that day one, even in orientation,
Mm-hmm.
they sent us into an SP suite. So SP is standardized patient.
Mm-hmm.
It's just actors who come in and pretend to be patients of different illnesses. And so day one, we were already in there talking to patients and getting feedback and taking histories and then moving on to physical exams.
Okay, that's pretty cool. What was the name of that course or that?
It's just called clinical skills, and it's we get graded each at the end of each block.
Okay. Yeah, because in PT school, we do have a class called psychosocial. You might know a little bit about what I'm talking about here, like psychosocial, like skills talking to patients that are dealing with abuse at home or dealing with violent partners. Like that's abuse, or dealing with other issues, or even how to handle and report people that are neglectful towards children. So we kind of did that a little bit. Is that kind of what you did too, or is it just like your day-to-day patient? Just what would you say? What would you do?
In the beginning, it was just very general. Like
Mhm.
I remember our first encounter, we had no prompt. It was just go in there and get to know the patient
Okay.
for 20 minutes. And like a lot of my classmates would and myself struggle with that because we didn't know what to talk about. Like that was day one of medical school, no knowledge of
Mm-hmm.
anything. So we just a little like thrown into the fire. But eventually it progressed to a wellness visit. And then the patient comes in with headache, what's your differential? What do you can do to help this patient? And then throughout our courses, these encounters are more specific to what block we're in.
Mm-hmm.
So the last block was neuro and psych. So we saw a lot of like SPs who had like schizophrenia or depression
Mm-hmm.
or tried to figure out patients with stroke. So it's very specific. So we're more specific than we were previously.
Mm-hmm.
I actually had a telemedicine like encounter with an SP who pretended to be abused by her partner, and that was pretty difficult.
Mm-hmm.
One of the more difficult encounters.
When you say SP is the name of like a student act. What does that stand for again?
Standardized patient.
Standardized patient. These are actors from the university.
Well, my medical school hires them.
Okay.
I think it's like a group.
It seems like this is a consistent theme that you have standardized patients
Yeah.
help teach you or are involved in a learning experience. So it seems like they're like a private company that organizes them, and then the university or just your school pretty much hires them. Or
Yeah.
okay, so that's pretty much a third party there.
Yeah, I don't know how specifically the process works, but I know like our medical school hires them.
Mm-hmm.
When we take our boards, it's called Step 2 CS, which is Step 2 clinical skills. We will have to perform similar encounters with these same standardized patients.
Have you met the same standardized patient more than once? Is that I feel like you see them so consistently.
I mean, there's a lot of them. Yeah, you see them.
Okay.
I've a couple multiple times, but I wouldn't say that I have seen the same patient, same SP a lot. That's a
How much
problem.
you get paid? That seems like a pretty fun job.
I don't I I don't know how much they're paid, but it seems like a nice job because they like when they come into school they get like fed and stuff, and then
Yeah. You said they get fed. Do you guys get fed too?
no, we get nothing.
Okay. Patients, well, at least the patient doctor interaction needs to get better or be improved. I think that's a common theme that we've seen over the past like 10 years. At least that's something that's like really like discussed in my program.
Yeah.
So that's good. It seems like day one that's been the major focus. So in a semester you could have 2 to 3 blocks, or
We don't have semesters.
you guys don't have semesters. Okay.
We have I think like 7 or 8 blocks.
All right, that's good to know. I was under the impression you had semesters that you were following. Okay.
Yeah, no, we have 7 to 8 blocks, typically 8 weeks. 2 blocks are 11 weeks. We do the clinical skills throughout all the blocks.
Okay. So for a year and a half, that's your core, your first half of your experience in med school, you operated under blocks, which were about 8 weeks to 11 weeks, more or less.
Yes.
So in total, I mean, from what you're saying, there's 52 weeks in a year, so probably
Six,
like
7 blocks.
seven blocks. Let's just say seven.
So yeah, so the first 2 blocks were like very general, just basic biology, chemistry, uh, biochem, crammed into 8 weeks.
Oh wow. Okay.
And then the next block was anatomy, crammed into 8 weeks, head to toe, all the body parts. Then after that, we had 11 weeks of the immune system, infection, cancer. After that, we had endocrine and like hemonc for 8 weeks. After that, we went for 11 weeks, did cardiac, pulmonary, and renal. And then after that, we had a block of 8 weeks with GI. And then finally, we just finished our last block of 8 weeks, which was neuro and psych.
Nice. So that makes exactly seven. Cool. Which one was your favorite?
Well, I love psych. So
Yeah.
I majored in undergrad and I loved it. And I loved the last block of neuro and psych. Not so much the neuro, but really the psych part.
Did you major in psychology, or was that a minor as an undergrad at Notre Dame?
That was a major, and I double majored in that.
Major, okay.
I never had any experience with psych, even throughout high school. Then I took intro to psych at Seton Hall my spring semester, freshman year. Loved the class. It wasn't even a great professor. I just loved the class. I think that's the only textbook I read cover to cover.
So you are thinking about becoming a psychiatrist, or what's your long-term plan?
At the moment, yeah, that's probably my top specialty. Still got about another year and a half for everyone to decide. So
you got time. You got a year and a half, before your fourth year, where that's an elective, right?
Well, the fourth year for our school is like special in that we can actually go into residency if we wanted to within the Hackensack network, or we can use the fourth year to do whatever we want and then apply to residency through the standard match.
Okay. What's next? I remember we talked about you being in JFK Medical Center in Edison, New Jersey, and you also going down the Jersey Shore for another hospital experience.
So it's called clerkships or clinical rotations. It's basically we just rotate through the different specialties, primarily to learn because it's gonna be on the boards, but also because it helps us like get exposure and actually see what the day-to-day of a particular specialty is like.
Mm-hmm.
So for the next year or so, a little more, I'll be rotating through each of the specialties. So at JFK, I start in neurology. So in these rotations, you just either follow a resident or attending, and then you see patients, you see different cases, you learn a lot because at the end of each rotation, you have shelf exams, which is just testing your knowledge of that particular area.
How long are you at JFK for?
6 weeks.
6 weeks.
Exact. And then, yes. Then I go to Jersey Shore Medical Center in Neptune, New Jersey for 10 months.
Oh yeah, that's where you're going to be long term. Okay. So let's go back to COVID, your first year and a half. So it seems like your blocks are about 8 weeks. So if we do the math right, you were in there for so between July to March, you probably did between 4 to 5 blocks before you had to get pushed online, right?
So we were in the middle of our fourth block when we went online over Zoom.
So how did that go? That's a loaded question. That's a very loaded question. So let's maybe narrow it down. What professor did things right? Like, what did you like about online classes, and what did you hate?
I don't personally. A lot of people liked like the freedom of Zoom, being at home. It depends on how the professor lectures, honestly, because you can't be as interactive over Zoom as you would in person.
Yeah.
A lot of our sessions were converted to straight lecture, post a PowerPoint, share a PowerPoint, just read through it. which it's really hard to just sit through. We had classes from 8 to 12, and they were mandatory attendance.
Did your camera have to be on? Was that forced on you or no?
Only for small groups, like
Okay.
more sessions, but like main lectures, the camera doesn't have to be on.
Okay.
And it was really easy for me to fall asleep during these sessions.
Yeah, tell me about it. Were your exams like, what software did you use, and did you have to have like your camera on recording you the whole time, or did you guys just not have exams, or how were you graded at that time period?
So our exams are through Exemplify. I don't know if you know that. It's an exam program.
Yeah, I use the same program. We call it ExamSoft, but I think that it's ExamSoft by Exemplify, if I'm not
Yeah,
mistaken.
something like that. One of those. So our first exam was unproctored. So they just gave us the exam over Exemplify. It was on your honor code. Next exam, they were still learning how to do it.
Mhm.
Was we did Exemplify, but we had to have our phone with Zoom on it. So they were watching us through Zoom.
Oh, okay. Wow.
And finally, our school took a long time to buy like Exemplify ID, which
Mhm.
that has the camera and
Hmm.
that like flags at your every movement.
Oh, wow.
Like if you're looking to the side or if you like talk or the background, you get flagged. And that was how we did our last 3 exams.
How did you feel?
It it is what it is. I mean,
Yeah. In my program, it was honor code, and that's only multiple choice exams because we also had other practicals that we did on Zoom. If you're in medical field, you're only cheating yourself if you cheat on an exam, because then like
yeah,
you can't do that when you're with your patient.
well, you can't do that on boards.
Yeah,
So
and you want to know, yeah, boards, exactly. Yeah, boards is even, that's a different story. That's like, definitely, if you're not learning it when you're supposed to, you're not going to pass that.
yeah.
It seems like COVID definitely was pretty hard on you too then, at least as it was for me and pretty much everyone. Is there any interactions between you guys and the class above you?
Because
I feel like I should have asked this earlier. How many people are in your class in total?
about 91.
Okay, so that's a big class. Yeah.
Yeah. So going back to your previous question, there's very little interaction between the classes because as soon as the new class starts, the second years are already getting ready to go to hospitals.
Yeah, that makes sense. Just like you are right now, pretty much. Student debt. How I think it's helpful for anyone that wants to go to med school to know what student debt is like. So you could talk about yourself, like how much debt you're going to be in just for med school alone, if you're willing to talk about that, and also how you think that compares to other the other med schools across the country.
I think, well, my medical school is private, so it's going to be a little bit more expensive than your state school.
Mhm.
But it's also probably a little bit more difficult to go to state schools because of that fact. So debt. Well, my master's. Let's just start there. So let's start with undergrad. I don't know if I should go into the money.
You can ballpark it. You don't have to go to like exact numbers, but you can say, yeah, just ballpark it.
Okay, so let's go back. Undergrad altogether with Seton Hall and Notre Dame, probably around like 20 grand in loans.
And you're dorming, so you're dorming during these years, right?
Yeah, and then I went to Case Western for my master's. Very expensive. Took a 40, I think it was 40 grand.
Mm-hmm.
So that bumped it. Now we're counting to 60. And then med school is 40 grand a year. So that's, no, not 40 grand a year. I mean, 40 grand, about 50 grand in loans a year.
Okay.
So, and since it's year 2, do the math, it's about 100 grand right there. And I'm only in my second year and I have another year to go, or maybe 2 years of loans to go.
Yeah. During your 4th year, you're going to be a resident, most likely, right? I mean, depending on what you do. Let's say you are a resident your 4th year, you get paid.
Yes.
Your basic resident pay, which is pretty shitty from what I've heard.
Depends on the specialty in the program, but it's typically around the ballpark of 50 to 60.
Okay.
Depending on
Gets you something.
Yeah, with loan.
And then So by then, you're going to be working as a resident for about 4 years. Is that? I mean, it depends. Like let's talk about psychiatry for now.
To become a general psychiatrist,
Mhm.
it's typically 4 years.
Okay. So once you finish your residency, then you take another boards or no?
Yeah. And then, so after residency, you can do a thing called a fellowship.
Mm-hmm.
Then you can even specialize even further.
Mm-hmm.
So I can use the example of like, after I become a general psychologist, if I want to work with kids, I can do a fellowship in child and adolescent psychiatry. That's typically 2 years.
Okay. Do you get paid for that?
Yes. So you when you're a fellow, your pay bumps. So each year of residency, your salary increases,
Okay, I didn't know that.
and then once you reach fellowship, you're just it goes up again, but you're still not at the levels of a attending doctor.
So you're gonna be a resident for 4 years. You think by your fourth year you'll be making like 80, 90,000, 80,000,
Oh,
$100,000, and not yet.
nope. I'll tell you. So I think by my fourth year, maybe 70.
Okay. And then by the time you're a fellow, is that closer to 100 by then?
No,
So it's still sub 100. Okay. And
maybe if I'm lucky, you get to 80. I'm not. I haven't looked up what fellows make.
so then you get your fellowship, or you finish that, and then you become a psychiatrist. That's somewhere between like 200 to $300,000 a year. Is that right?
Yeah.
Okay. Math would kind of get me to you paying off your debt probably by like in 10 years from now, more or less. Because I feel like once you're a psychiatrist, it's pretty easy to pay it off, but it seems like that there's a long road to get to that point.
Yeah. So we had like lectures on like
That's
debt
good. Yeah, the talk. Okay.
and loans and stuff, and there's a lot you like looking far out. It's easy to say, okay, I'm gonna make 260 or 280,000, and I'm gonna pay off my debt like that.
Yeah.
But you have to factor in like
Interest.
lifestyles, like you
Lifestyle.
want to get married, do you want to start a family, do you want to buy a house, do you want to buy a car, other obligations have to get taken care of. So most doctors, after they finish residency, take like 7 to 10 years to pay it off.
Mm-hmm.
Even more than
After they finish a residency, so that's like okay, a while from now. I think that those are like all the major questions I wanted to hit. I think you really explained pretty well what your program was like, which I wanted to ask about. Financially, it's like to be a med school student. Also, what it felt like during COVID and that transition and how it went. I think you froze on me or I froze, one of the two.
that. I think we both froze.
You probably both froze. Honestly, the Wi-Fi in my apartment is really terrible for whatever reason.
We only stopped a couple times during this entire call, so
That's good then. Maybe I'm giving it too much. I'm not giving it as much credit. Overall, I think it's been a really successful video call.
yeah,
I wish we could have done this in person.
maybe we can do it when I graduate, and then I can give you the full like medical student school experience.
Yeah, that would be fun. Andrew, thank you for being on the show. It's really good to have you, and you're my first guest via the Zoom format. So I hope to have other people on the show talk about their experiences as well in the future. So it was really good having you. I want to keep this format going for future videos. And I'm sure that if anyone has a question for you, they can just pass the message along to me, and I'll give them your email if that's okay with you.
Sure. Um, Thanks for having me on the show. It's been a really nice discussion, and yeah, whoever wants to contact me, feel free. Always looking to help a fellow med student or someone trying to get to school. So
Yeah.
thanks again.
Yeah. Yeah, thanks for that. There's a lot of people I'm sure that are interested in med school, or even if they're not interested, want to know more about med school. So thanks for being that contact. For now, I think that this is how I want to carry the show, everyone. I think that I want to have guests talk about topics that are interesting as it relates to their careers, mostly their careers. Maybe it can segue to other things, but I think I like this because I feel like I learn a lot, and you guys can also hear and learn a lot from others. And that's what I kind of want to do. Every now and then I'm also going to throw in an episode about something that I think is very newsworthy and I want to talk about. Look forward to that in future videos. If you haven't hit that like button and subscribe, please do so. It means a lot to me. If you have any comments, put them in the comment section below. I read through all of them, and any feedback, any tips that you have for me would be great. I'll see you next time. Thank you for watching.
Thank you.